What kind of revision can be done for me to get the results I was hoping for? I had upper blepharoplasty 2 weeks ago, and I'm scared. I'm hiding from friends and family. One eye looks much smaller than before surgery, and the other won't open over pupil, yet that eye still looks larger than the other side. That side is also very blurry now. I suppose that will be okay. I just want to know what can be done to make my eyes beautiful again. I had extra skin I wanted removed. What revision will need to be done to make my eyes look refreshed, revitalized, and even?
Thank you for your question. You submitted a question with photos stating that you had eyelid surgery approximately 2 weeks ago, and you're asking about a revision due to your concern about the left upper eyelid looking significantly lower than the right upper eyelid, and your photos certainly reflect that appearance. So, based on your photos, you have what is commonly referred to as ptosis. And ptosis means the upper eyelid is lower and closer to the pupil, and it's a general term, but when you talk about eyelids, it's eyelid ptosis. Now the question we have to ask first is, was this ptosis pre-existing? In other words, during your evaluation, if you look at your photos prior to surgery, was your eyelid on that side that low, or was it maybe a millimeter higher and there was still some asymmetry between the two eyes? It is certainly a possibility in the absence of me not seeing your preoperative photos. Now, if we assume that the eyes were equal and the upper eyelids were symmetric and high, just like the right upper eyelid, then the question now is this ptosis the result of some type of injury during surgery? Is it due to a sequence of some swelling and some trauma? If that's the case, then a lot of times the ptosis can resolve on its own. We refer to this when there's a lot of swelling, we call that traumatic ptosis. But if someone has ptosis or is on the borderline, sometimes cosmetic blepharoplasty can uncover or manifest the ptosis after surgery. In a situation like yours, when people like you come to my practice, I'm a cosmetic oculofacial plastic surgeon, and ptosis is one of the most common procedures we do, ptosis surgery. We will usually allow a little bit of time after the initial surgery to determine if the eyelid height is stable. Now, this time frame is based on observation during several week gaps between visits to determine if the ptosis is in any way improving during that time frame. If it is not improving within the first month to 2 months, then we can then move forward with doing some type of revision surgery. What we try to do is avoid operating on tissue that is swollen. But at the same time, having the asymmetry can be very distressing, and so we customize our approach for each individual patient. And of course, we often will see when patients come in for revision surgery by other doctors, they'll often come with their preoperative photos, so we can actually make a comparison and determine what the situation is. So, that being said, I think it's still important to communicate with your primary surgeon, the doctor who did your surgery originally, and review your photos and discuss with the doctor what to anticipate and expect. No one knows your anatomy better than the original operating surgeon. And if you feel that your doctor is comfortable and confident about the ptosis and you can wait it out, then waiting does no harm. Beyond a certain point, we can probably reasonably conclude that the ptosis is not going to get better and that ptosis repair will be necessary. Ptosis repair in our practice is performed under local anesthesia with light sedation, and what we do is we actually move the muscle, the levator muscle, the muscle that lifts the eyelid, and adjust it, and it actually will sit the patient up during surgery to maximize the symmetry and to make sure that gravity balances, that the eyes look balanced with the gravitational aspect being in place. It's a more complex surgery than most general plastic surgeons are familiar with. It's very unique to oculoplastic or oculofacial plastic surgery. The point of saying that is that you don't want to rush into a procedure like this. Every ptosis surgery has a risk of needing more surgery. The eyelid could be too high, it could be too low afterwards. So if this is a manifestation of a swelling at the cellular level or at the level of the tissue behind the eyelid from what you can see, then it can potentially get better on its own. But but I think that within the first 2 months, you can pretty much make that determination. And again, waiting, there is no harm in waiting. You can wait much longer than that, 6 months or longer, and then have the ptosis surgery performed. But seeing how you are very concerned and it's been socially problematic for you, most likely with the balance of swelling and everything else, expediency may be the best solution for you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.